volunteers really become a very integral part of the team. They're there in supportive roles to really help the professional staff provide that exceptional care to the patient. But at the same time, the volunteers allow them to be able to do that job.
Is that good for your pillow? And then you want to slip back?
Our nurses and physicians and techs and pharmacists and aides couldn't do what they did without that support of the volunteer team.
You want to keep busy. And I think that's what a lot of people do. They enjoy coming in, and it's fun to come in and talk with the ladies and sew and keep up with what's going on. And it just sort of, for me, you look forward to it. I mean, my Thursdays and my Mondays, I get up and I'm ready to go. And those are days, and then I work everything else around it. There's so many different areas that you can volunteer, and you can sort of pick and choose. When you come in and interview, Katie will ask you, what are you interested in? I didn't want to volunteer every day. I wanted to have time to be with family, to be with my parents, to be able to take trips, and I didn't want the 40-hour week again. I wanted basically to give a couple hours a week. The only way I can express it is it's just an inner thing, something inside of you, and it just makes you feel good. It's a feel-good, warm, fuzzy, whatever. So it's we're doing it because we want to do it, not because we have to do it.
And would you like a receipt?
Yes, please.
Okay.
Working in our gift shop, which is really one of those places too where that's where people tend to migrate to when they have a loved one in surgery or in ICU, when they're just trying to pass the time and might be, struggling with some worry and fear and uncertainty. And so volunteers in any capacity anywhere have that opportunity to provide a listening ear or that gentle touch or smile and just be a support to them at a time of real crisis.
I try to be extra enthusiastic, so if they're feeling down, I try to be happier. I think most of the time I am a pretty happy person, but I want to lift their spirits, make them feel better. And that is $13.51.
Thank you.
Sometimes when people come into the gift shop looking kind of sad, and then I talk to them and they leave looking happier, or like I made their day a little better, and that makes me feel really happy.
Okay, is that better, Bessie?
That's fine.
Okay, all right, here's a blanket. I am actually a 12-year breast cancer survivor. I was very fortunate. I only had to have surgery. I did go through about 7 weeks of radiation treatments, but I had very few side effects from all of that. And so I just really wanted to give back, and I knew that's where I wanted to be.
Yes, I come here. These are all my girls. Jane's always there, ready to get my blood for me. And she's there to ask if I need something because I can't eat anything in the morning. And when I come here, a lot of times it's kind of nice to get a pudding or sandwich or whatever. She's there. So I'm real pleased with this.
So you mentioned that you want to give back. Are you feeling like you're achieving that goal?
Yes. Yeah, every day, because when you come in and you think, you think you're having a bad day or something happened the day before, and then you come in and see your patients and some of them aren't doing real well. So you have to be thankful for what you have. I'm sorry.